All right, good afternoon, everyone. I think we're live and now on YouTube. Happy New Year. It's good to see everyone in person, well, at least over the Zoom. I wish we could be in person, but it's good to see everyone's healthy and we're all poised to have a great new year. Before I start, I did want to congratulate Judge Ripken for her recent appointment to the Court of Special Appeals. So congratulations. I look forward to voting for you in executive nom. So really excited and congratulations. Wanted to say that up front. So that's really great news for the state of Maryland. Obviously, before we start here, I wanted to just provide a few brief remarks and just thank again everyone that participated in our hearing this past in May, and then also in the development of the recommendation, and for Senator Carter and her leadership on that committee, and for the fine report that she published. We're looking forward to getting some feedback on some of those recommendations, as I know that some folks on the committee and throughout the assembly have moved forward on drafting up some legislation to further those recommendations. So I just want to say thank you to everyone for your participation, not only in May, but also in the development of the recommendations, and especially Senator Carter for your leadership and for being chair of that commission. So today, what we have folks here from the Maryland Judiciary, obviously, and I see Chief Judge Barbera there on the screen. So good to see you. Thank you for lending your time. We've got folks from the Department of Public Safety and Correctional Services, Department of Juvenile Services, Office of Public Defender, Maryland State's Attorneys Association, Police Chiefs Association, Sheriff's Association, and Correctional Administrators Association. So a wide gambit of expertise here today to comment on the status of courts and corrections and our correctional facilities in the state of Maryland, as we are still very much in the midst of the pandemic. Although the vaccination has started to roll out, I actually know a couple of people that have received their first dose this week. So obviously, one of the reasons that we started this process was to capture some of the lessons learned from this process and from this experience that we've been going through. A lot of the things that we've been forced to do and the manner in which we've been forced to innovate were thought to be impossible a year ago. And so the important part for us here today is to understand where we are and to see if there were some lessons learned throughout this entire process that we can carry forward to make our system a little bit more equitable, just, and efficient, frankly. So with that, just want to say thanks again for everyone. And we will start off with the Maryland Judiciary, and we'll start off with Chief Judge Barbera. Thank you again very much. There we go. And Sandy, there we go. I think you are unmuted, Chief Judge.
Yes, I was. So I hope you won't be startled to see me remove my mask, but I can assure you we are in a very, very large room, and there are just 5 of us here, so well spread, socially distanced, and we have our masks. We'll remove them as we speak and answer any question that you may have. So thank you for including us in this presentation, opportunity to brief your committee and certainly to hear and respond to your questions as best we can. So with that, I begin. Good afternoon, Chairman Smith, Vice Chair Waldstreicher, and my senator, members of the committee. That is, Vice Chair Waldstreicher is my senator, so I have to give him a shout out. I hope that you all are continuing to be safe and well. For the record, my name is Mary Ellen Barbera, and I'm the Chief Judge of the Court of Appeals of Maryland. With me this afternoon are Judge Laura Ripken in her capacity as Chair of the Conference of Circuit Judges and as Circuit Administrative Judge of the Fifth Circuit and County Administrative Judge of the Circuit Court for Anne Arundel County. And I might add, because I'm personally very excited and proud for Chairman Smith, and as of this past Wednesday, Court of Special Appeals Judge Designate. The Circuit Court's loss is the Court of Special Appeals gain, and the people of Maryland throughout will benefit from her good work. Also with us are the inestimable Chief Judge John Morrissey, Chief Judge of the District Court of Maryland, and Pamela Harris, the State Court Administrator. Mr. Chair and members of the committee, the judicial branch, as you know, I hope, know that during these unprecedented and challenging times, we have continued to carry out our core functions. The courts and administrative offices, led by Pam Harris, the our administrative office of the courts, has since early June embarked on a phased and carefully resumption of full operations, culminating in October with jury trials. The courts, with the administrative office of the courts, expended enormous effort and resources to implement health measures for in-person matters, provide reliable remote alternatives to in-person hearings, which, by the way, are going remarkably well. You'll hear more from Chief Judge Morrissey and Judge Ripken on that, and the restart of jury trials with the appropriate health measures for jury pools. Unfortunately, as we all know, the surge in community spread of the coronavirus, with the numbers worsening during the holidays, has forced a reduction in judiciary operations. So it was that by November 12th of this past year, after consultation with, of course, the Maryland Department of Health and Judiciary leadership, I made the decision to move us back from what for a short time was in full reopening, phase 5, to move us back to phase 4, emergency operations. Once again, suspending jury trials for reasons that I'm sure all of you can appreciate. With jury trials, you need jurors. You need other participants, other folks in the room in a way that you can't have, at least certainly that we're not doing in Maryland, have run virtually. So we went back from phase 4, or we went back to phase 4 and put in a stasis jury trials at that time. And then it was 2 weeks later that I ordered, again, after consultation with the Department of Health and Judiciary leadership, who are with me, as you know, today, the return to phase 2 operations. And I've extended this level through March 14 of 2021. We heretofore had been using 6 weeks as a good estimate of how we might be able to move forward when I'm talking back in the spring and during the summer. But on this occasion, I felt it important for everyone to recognize that we are, because like you and the members of the committee, we watch the news, we listen to the scientists, we follow the daily reports on positivity rates, etc. So we want to be conservative. And so we moved back to phase 2. And that's where we will remain, as I mentioned, through March 14, 2021. But compared to last summer, our operations in phase 2 this time are far more extensive than they had been, given the now robust capacity of courts to hold remote proceedings. We have grown in many ways, used to use reliance upon remote proceedings, just like the one that we're all participating in this moment. And we have had remarkable success, not surprising really, because everyone works very hard to make this happen, all our justice partners. The Court of Special Appeals and the Court of Appeals, for example, are able, I'm pleased to report, to maintain full operations, even in phase 2, because we have been hearing our oral arguments virtually since late spring. We continue to monitor the trends daily, I can assure you of that, and we are poised to move to a higher level of emergency operations as soon as the advice of MBH and our analysis of the trends will allow. Again, I'm sure that's consistent with exactly how you and yours are thinking about what next steps need to be and when. I will close as I wish for my colleagues, Judge Ripken and Chief Judge Morrissey, to be able to give you far more of the details than I will offer in these couple of minutes. And they can tell you, quite frankly, much of the work is going on in the trial courts. That's really where it's happening. I must first, however, acknowledge the work of the judiciary leaders, only a few of whom are here today, and the personnel who have labored. They've labored assiduously throughout the COVID-19 emergency. They've worked to ensure the continuity of the operations in the administration of justice through, I think we can all count on this being an accurate description, unprecedented challenges. They have been unprecedented, but like you and your fellow members of the legislature, we too are working to achieve those high goals. This includes, of course, service on the new Committee on Equal Justice. I hope you are familiar with that, Chairman Smith, and if not, we can give you a briefing on that at another time, which I directed be formed this summer. And we have several subcommittees and some work groups who are working with that committee, beginning to do very, very good work. It is chaired by Court of Special Appeals Judge Greg Wells. The committee will be making recommendations to strengthen the judiciary's commitment to and the implementation of equal justice under law for everyone. In a time that has been trying and disheartening on too many levels, far too many levels, it is the commitment of the judges and personnel to the rule of law that continues to inspire the work we are all able to do. I'm so proud to be a member of the Maryland Judiciary. To each of them, I am most grateful. We have a long way to go before we see the end of this pandemic, but Mr. Chair, Mr. Vice Chair, and members of the committee, I'm certain that we will get through this together for the people of Maryland. Thank you all. I will ask that we answer questions at the end of our presentations, if that is acceptable to you, Mr. Chair. And so with that, I will turn things over to Judge Ripken.
Good afternoon, Chairman Smith, Vice Chair Walt Stryker, and members of the committee. And thank you for your kind words of congratulations, Chair Smith, at the beginning of your remarks. I, for the record, am Laura Ripken here today on my last day as chair of the Conference of Circuit Judges. With respect to the 24 circuit courts of the state of Maryland, daily operations of essential functions have continued through all phases of the crisis that we are currently facing. The circuit courts move progressively through the various phases, consistent with Chief Judge Barbera's administrative orders. While the judiciary did reach the resumption of full operations, which included jury trials, we were certainly forced, as Chief Judge Barbera indicated, to retreat to previous phases as COVID infection rates grew. Jury trials were conducted in the circuit courts from October 5th of 2020 to November 13th of 2020 and are scheduled at this point to resume on April 26th of 2021. While we are not conducting jury trials presently, we are still conducting court. For the circuit courts, this includes, in addition to various civil and family law matters, a wide range of criminal and juvenile matters. Included among the various matters we are handling are bail reviews and reconsiderations, the addressing of bench warrants, arraignments for detained defendants, handling extradition cases, addressing competency issues, and doing certain types of plea agreements and sentencing. In the juvenile arena, we are handling a wide variety of dependency and delinquency matters. Problem-solving courts are continuing to function at this point. Everything that can be done in a remote fashion using audio and video feeds is being conducted in a remote manner. If in-person proceedings are required, they are being conducted in our refurbished courthouses, which are outfitted to be as safe as possible. The good news is that we have been down this road before and are prepared to deal with the various circumstances we find ourselves in now. As we initially moved between phases, we made adjustments as appropriate that led to improved efficiency and improved safety. Our courthouses have been modified to include plexiglass, hand sanitizer stations, social distancing, limiting numbers in the courtrooms, and remote proceedings as appropriate. Our sheriffs are conducting screening at the front doors and taking temperatures. During the time that we were able to conduct jury trials, we did so in a very successful manner. We allocated spaces across the state for safe jury selection and conducted trials in socially distanced, heavily plexiglass courtrooms with new and creative technology, including a completely new manner of bench conferences that is likely to stay in place well beyond this emergency state. In the state of Maryland, I am proud to report that we conducted 88 jury trials, 65 of which were criminal and 23 of which were civil. Those statistics do not include court trials. By way of comparison, I read in the New York Times, who reported on December 2nd of 2020 that only 9 trials had been conducted in the nine months in New York City. Our trials were safe and they reached a verdict, and the circuit courts across the state are very proud of the manner in which we were able to be successful. We are moving forward, and while there is much to address as we move out of this emergency, there is also much that has been accomplished and is being accomplished on a daily basis. Once again, I would be remiss if I did not take a few seconds to acknowledge the diligent work of the staff of each circuit court who are on the front lines of the judicial branch every day, taking care of business and ensuring that we are prepared to move out of this emergency safely. It has been my honor to represent the circuit courts during this challenging time. The Conference of Circuit Judges met earlier today and elected the Vice Chair, Keith Baines, as the next chair of the Conference of Circuit Judges, and as the new Vice Chair, Audrey Carrington, Judge Carrion, of Baltimore City as the new Vice Chair. So I turn over the reins to their highly capable hands. And I thank you not only for your time and attention today, but also for your service to the citizens of Maryland. Chief Judge Morrissey.
Good afternoon, Chairman Smith and members of this committee. I hope you are safe and well and had a peaceful holiday. For the record, my name is John Morrissey. I'm still the Chief Judge of the District Court. It seems I'm not going anywhere like Judge Ripken. Congratulations, Judge Ripken. Since November 30th, 2020, the District Court has been in Phase 2 operations. In Phase 2, as to criminal actions, the court will continue to hear bail reviews, bail reconsiderations, as well as bench warrants. It will also conduct trials for incarcerated individuals, trials for other criminal actions alleging violent acts, including domestic violence-related actions, and alcohol-related motor vehicle cases. Guilty pleas continue to be heard, as well as mental health evaluations and placements. Preliminary hearings, violations of probation hearings, and juvenile waiver hearings continue to be heard in all districts. As to civil case types, emergency evaluations, quarantine and violations of the governor's COVID restrictions, body attachments, temporary and final protective order, peace order, and extreme risk protective orders, and temporary restraining orders are heard daily by the district court. As to landlord-tenant case types, the courts will hear rent escrow actions provided local inspectors are operating, emergency breach of lease cases involving threats or injury to people or property, emergency wrongful detainers, and emergency tenant holding over actions. Extant warrants of restitution will be processed on a case-by-case basis to ensure that a tenant will be given the right to assert the defenses found in the governor's order on evictions and the CDC agency order as was recently extended by the Federal Consolidated Appropriations Act. Any judgments that were reserved based on the governor's order will be held until such times as the governor's instructions, and any judgment reserved based on the CDC agency order will be held until January 31st unless extended. Failure to pay rent cases are being accepted by the court, but will not be set for hearing until circumstances with the pandemic permit. Problem-solving courts will continue to operate as they have through the entire pandemic, and the commissioners are operating the same way that they would have absent the pandemic. Courts are offering the ability to conduct proceedings remotely throughout the district court, although remote trials in some criminal matters may not be appropriate. Additional case types may be heard by the courts to the extent that they have the ability to handle such cases, and most will be done remotely. To give you an idea on how far we've come from the original phase 2 in terms of a remote capacity, in the original phase 2, we handled a little over 1,400 remote hearings. In the current phase 3, phase 2, we moved very quickly from phase 3 back to phase 2. But since November 16th, we've conducted more than 14,000 Zoom hearings. The district court, and that's both the district court and the circuit court. The district court, as well as the whole of the judiciary, has worked diligently to communicate throughout the pandemic to the local bar associations and the public to keep everyone apprised of any changes in court operations. Each district court location now has its own web page, which includes local administrative orders, communications from me about statewide processes, and docket board information so participants can see up-to-date information about their hearings. Since the first week in March, administrative judges have continued to review the list of those individuals then incarcerated and worked with their local jails, police, state's attorneys, public defenders, and local departments of health to maintain operations during this pandemic. On a statewide basis, we have had an active and ongoing collaboration and cooperation with the Department of Public Safety. We actually have a meeting next week, the Department of Health, and the Department of Housing. Many thanks go out to Secretary Green and his staff, Acting Secretary Schrader and his staff, and Secretary Holt and his staff. Finally, I'd like to acknowledge and thank the judges, the clerks, and in particular the bailiffs and the commissioners of the district court who are on the front lines of keeping the judiciary open for business. And I'd be happy to answer any questions. I think all of us would. Thank you very much, Mr. Chairman.
So you can tell them that concludes unless there's any questions.
Did you have any questions for us, Mr. Chair?
Thank you, Judge. So actually, I was wondering, we have on the agenda Ms. Harris, but that's it. So you all are complete. This completes the panel?
Yes, I'm here just for any follow-up questions. Sir.
Okay, great. Fantastic. So I'm going to make an exception this time because we have the leadership of the judiciary here, the entire leadership here. We can allow questions of the judiciary following their presentation. So members of the committee, if you have questions, feel free to raise your hand. I'll continue to look around the Zoom room, but raise your hand if you have questions. Senator Carter, did you have a question or good to go?
Yes, thank you, Mr. Chair. And, thank you, Judge Morrissey, Judge Ripken, and Judge Barbera, Chief Judge Barbera. So first, I want to say I really appreciate and thank you for all of your vigilance and vision in shepherding the courts through this process in this very troubling pandemic. I do have some questions posed to whoever is best equipped to answer. The first is with regard to the administrative orders, who's responsible for carrying out those orders, for overseeing compliance with those orders? And I'll explain the reason for my question is I've personally been in courts throughout the course of the pandemic where there is inconsistency. There's inconsistency in terms of the number of the protocols that are put in place in very different courts, depending on whether it's the jurisdiction. So in terms of the number of people that are allowed in court, I remember the first time I went to district court in Baltimore County during the pandemic, I expected that the way that I anticipated that, we'd be let in, only the parties that are associated with the case would be in the courtroom at one time. And then when that was done, then others would be let in, but that wasn't actually the case. Multiple parties were let into the district court, and this was Baltimore County at one time. And with respect to the plexiglass, both in district court and circuit court, my experience was that the only plexiglass was between the judge and everyone else, but there wasn't plexiglass, for example, between the defendant, defense, and the prosecution, or between the parties and any witnesses that were in the courtroom. And so it goes to inconsistency that I've seen. And how can we do better at making sure that there's consistency across jurisdiction and courts?
Well, let me just speak briefly, and then I'm going to turn it over, of course, to the folks who really know the details. And it's a very good question, Senator Carter. Thank you, and thank you for all your work that you've done on behalf of the people of Maryland. So the administrative orders that I assume you are referring to are the ones that I issue. I will tell you, I do this with collaboration with the leadership of the judiciary. Certainly, the three people who are with me this afternoon, Chief Judge Morrissey, Judge Rifkin, and State Court Administrator Pam Harris, and others. And then on the day-to-day, and Chief Judge Morrissey or Judge Rifkin will tell me if I'm wrong, my inclination, and certainly my assumption, is that the administrative judges who run the respective court houses, if you will, they're the ones on the ground as well. They're the ones who really know what needs to go on and how to handle the particular, whether it's composition of the courtrooms, where the plexiglass is to be placed, and so on and so forth. But I have trust in their carrying out their duties. Now, it doesn't mean that in every courthouse at the same time all of the safety precautions were able to be put into place. We obviously have had challenges, particularly in those first couple of months. I think we're in pretty smooth sailing now, but I will cease, and actually Pam Harris will probably also have some comments that I think are going to be helpful in response to your question. So Chief Judge Morrissey, did you want to address that first?
Sure, absolutely. Thank you, Senator, and I appreciate your concerns. I too have concerns. The way it works in the district court is that Chief Judge Barbera will issue administrative orders. That goes out to all the district court judges, all the circuit court judges. We have weekly, in the beginning we were having 3 times a week. Now we're currently on a 1-week cadence where I talk to all my administrative judges on Wednesdays at 12:15 at noon in between their dockets. We disseminate any best practices at that. We go over the orders, make sure everybody understands them. So that's the way the orders get disseminated. With respect to the provisioning of each courthouse, the original provisioning was for the judges and the courtroom clerks. We have had additional provisioning now for the tables between counsel and in some places between the bar and the rest of the court. There is some concern that sometimes these plexiglass can be used as weapons in court, and each courtroom is kind of laid out differently throughout the state. So I've relied on the discretion of the administrative judges and the administrative clerks to provision their particular courthouse. But we have ordered more. I've instructed them all to put as much in there as they can feel comfortable. We're also trying to move and upgrade in the district court to a better type of thermometer that can read individuals when they come in the door. But Senator Carter, if you or anyone else has any concerns about a particular jurisdiction, do not hesitate to send me an email or a call, and the first thing I will do is pick up the phone and call my administrative judge and clerk, and we will make sure that any concerns are rectified. It is, there is policy and then there's what actually happens, and I understand that. We're working to make both match.
Thank you.
If I could just add in, Senator, thank you for that question. The circuit courts work very similar to the district courts in regards to, we have a weekly meeting. Ours is Thursday, and we discuss all of the administrative orders, and then it is up to the individual administrative judge to see that they're carried out. We certainly, those meetings are very, very effective and helpful in terms of sharing information as to what's going on in different jurisdictions. Of course, as Chief Judge Morrissey said, each jurisdiction has to deal with the building that they have and what they have to deal with. We're all working with our sheriffs in terms of security issues and our local health officers in terms of their recommendations for our buildings. But I agree with Chief Judge Morrissey. If you have a particular concern, in the case of the circuit courts, it's probably most helpful to contact the administrative judge for that particular jurisdiction and let them know what you've observed. But I'm sure that Judge Baines will be happy, or Judge Carrion would be happy to hear from you in terms of the circuit courts in general in the future. I know that the courtrooms are being monitored, and I believe most of the courtrooms have a posting outside of each courtroom in the courthouses indicating the number of people that are permitted in, which are being monitored by the sheriffs. I can't tell you exactly what happened in Baltimore County Circuit Court, but I can tell you that more plexiglass has been added as we have been moving through the phases, including plexiglass in the places where juries are being conducted. So thank you. It's a good question. Thank you.
Thank you. As a follow-up, with the delay of the jury trials not being resumed until the end of April, has there been consideration given to possibly to what we can do to conduct a more robust review of those detainees that are now for an exorbitant amount of time awaiting their jury trials, in terms of how we can any people that are not necessarily being held given in this expanded amount of time that they have to wait?
That's a really good question as well. And if I could jump in there, Senator, on that, we are all reviewing the list that we get regularly from the jails and reviewing them, making sure that anyone who wants a bail review, and in fact, we have held many additional bail reviews, and we're now revisiting even those that judges decided to hold when they looked at them again last go round, to make sure that still is appropriate given the circumstances we're in, understanding that they're not going to get their jury trials till at least close to the end of April. So we're very cognizant about that. We talk about that almost every week on our administrative judge calls, and we carefully look at those lists and as well as motions filed by defense counsel, by the state sometimes, and individuals filing, in fact, on their own, asking for additional bail reviews. And we're holding a significant number of bail reviews and very cognizant of that concern. And it's a legitimate concern.
Thank you. Is there any, with respect to cases referred for drug treatment and evaluation 8507s, my question is, there's a great many people, of course, that could benefit from it. And I'm wondering if how this affected those referrals. I know that the volume in the courts is lower, so of course that's going to be lower. But is there any need or any impetus behind expanding the use of 8507 referrals to make sure that it's another way to possibly depopulate the jails and the courts?
Okay, take this on.
Yeah, go ahead.
Okay. So thank you, Senator Carter. It's interesting. We spoke yesterday on the Justice Reinvestment Committee, which myself and Judge Cox are on, and a number of law enforcement, and we talked about that yesterday. The volume of people getting arrested, which is a good thing, I think everyone would agree, is less right now. There are certain decisions by certain prosecutors not to prosecute certain drug crimes, so the volume is down again. We have continued to operate and continued in cooperation with the Department of Health to do 8505 evaluations. We figured out through, and I think Senator Green our Secretary Green will probably talk about this a little bit too, how we went to a telemedicine. It's interesting, about a week before the pandemic hit, we had a communication about starting a pilot in one location for telemedicine to see if we could make it work. And about a month later, we were doing it everywhere we possibly could. So the pandemic did have some benefits in terms of accelerating things that we've always wanted to do. But we've continued to do that. And I know as recently as Monday, Prince George's County had 2 placements in. I know that some of them are dependent right now, and the Department of Health has been doing a great job on it. They're dependent on whether there's any type of pandemic at the particular location where they're sending them to. So there have been some delays as a result of that. But as soon as that clears, then the health department is making sure those placements are occurring. So we're concerned, obviously, about the volume. We're hoping, I don't want more volume, obviously. I did agree yesterday at the Justice Reinvestment to remind my judges of the possibility of using, it's used a little differently in the district court. It's used on the front end of the district court. That is an option in terms of sentencing, or even in terms of pretrial. And so I will continue to remind them of that and encourage them to keep that in review if it's the appropriate case.
Thank you. Just a couple more questions. I promise, Chairman Smith, I'll be brief. Do you have a schedule or protocol yet for the vaccination of court personnel?
We do. We do, but for the details, lest I may get some piece of this incorrect, may I turn to you, Ms. Harris?
Yes.
Respond to the question.
Thank you, Senator. Yes, we have some of our frontline employees have been offered to take the vaccinations in each county. Some local health departments are going forward and vaccinating all of the court employees. Others are doing just the frontline employees, and those frontline employees are in the courtroom or at the cashier's desk, or the bailiffs, or the guards letting people in the building. And I think this is important to note. We are going to do some sort of campaign to express our deep desire for all of our court employees to have this vaccination. We are finding that between 40 and 50% of the employees are turning the vaccination down. There's fear out there about the vaccinations, unfortunately. But the frontline employees are on a list to have the vaccinations, and some of them are done. Some jurisdictions are done, and hopefully by next week, so those frontline employees will be done.
Senator Carter, I didn't make the list. I'll wait until the whole judiciary is able to get theirs, because I don't consider myself frontline.
Thank you. Final question for you, Judge Morrissey. So, you know, I understand the reason that we have to focus on the more serious cases and the persons incarcerated, moving those cases along. But I've had a number of cases that, you know, since the beginning of the pandemic, since from March to May to October to January, and district court cases that are now, these people are not incarcerated, they're you know, on release, awaiting their trials. A couple of them are misdemeanor violence, assault cases, but the court has continually on its own motion just canceled the court date, and then, you know, it's rescheduled. My question is, because in district court, sometimes it's hard to get a hold of one state's attorney, for example. You know, they switch depending on the schedule of the court and the date of the court. So you can't consistently have one person to work through a case with. My question is there any way or possibility of what before the court just, you know, on its own cancels a court date such as that there could be a way to maybe schedule a remote hearing to see if it could be worked out? Because I really believe another number of these cases will be dispensed with, and I get they're not the priority, but people whose lives hang in the balance while they're waiting for a disposition in their case, even though they're outside, they're not incarcerated.
Senator Carter, that's a great point. We have encouraged at every chance we've had the state's attorney, the public defenders, and the bar to review their cases and try to get them worked out. What we don't want to do, and what's painful to us, is we set a case for trial and then it settles at the courthouse when it could have been settled either remotely or previously. I've encouraged all my judges, and I know they're doing this, that if you think that you can resolve it remotely, we have a form that you can ask for a remote hearing, and they'll certainly consider that. And I know that's what we want to happen. We want it before it actually gets into court. However, you know from practice in law and in the court, sometimes you need to have your client there and you need to see what witnesses are going to show up, and you're not willing to take any action until everybody's there and ready to go. And I know that is your right as defense counsel, and maybe it's your obligation as defense counsel, but we are in a unusual period of time right now. And I would strongly encourage everyone to try to focus on the cases that they have and get them resolved prior to having to drag, defendants and witnesses into court. We can do anything that you agree upon remotely. I would have a very difficult time conducting, unless all parties agreed to conduct a criminal trial completely remotely. That would raises all, I'm sure as you're aware, raises all sorts of issues that can be extremely problematic. But in terms of the scheduling, and I do apologize, as we move from phase to phase, there's not a whole lot of time for the administrative clerks, and I really have to commend them because we've asked them to do things that they've never had to do. There's no playbook for any of this. There's no script. We've asked them to do things they've never done in their entire judicial careers, and some of these people have worked for the judiciary for more than 30 years. And it has caused some confusion, and for that we apologize. But there was also an obligation with my administrative judges to try to get whatever they could get done, because if we can only move 1 or 2 individuals that are incarcerated a day, but we have 2 or 3 other courtrooms that are available, and we can safely distance and we can make sure all the safety protocols are in there, we all want to do that, and we want to keep going with what we can because we're afraid of the backlog, basically, that we know is going to come. And anything we can do in the meantime, safely, obviously, we want to try to accomplish. The more remotely, the better it is, in my opinion. So I hope that answers your question.
Thank you.
I almost called you counselor, but I meant to say senator.
Thank you.
All right, great. I think we have a question from Senator Hettleman.
Thank you so much, Mr. Chairman. I guess I want to follow up on my colleague's question about vaccinations. Can you tell us exactly how that is being done? Who is doing that? Is that health department personnel, or your folks supposed to go to the local health department to get their vaccinations? Can you just shed a little more light on that for us, please? Because we've been getting some information from the health department, and I'm just curious about how you're doing it.
Yes, each health department and each jurisdiction is administering the vaccinations. A list is provided of the court employees that are frontline employees to the health department, and they get an appointment, or depending on the health department, really, how they are administering the vaccinations. But each local health department is doing that.
Thank you. Very helpful. Thanks.
As tangentially, Senator, I heard in Baltimore City it's running extremely efficiently. Apparently, it's being conducted at the Under Armour facility in one of their larger buildings and parking lots, and that it was seamless from all the people that I heard that have gotten the vaccine already.
We've heard that from many.
Multiple other, yep.
Senator Hettleman, all good? Great. I think we have Senator Huff has a question. Hey, glad to see that you are safe. I know you work on Capitol Hill in the interim, so I was thinking about you. I did get information you were safe, so I didn't acknowledge, but good to see you.
Yeah, I put something up on social media. I had the displeasure of sleeping in the Capitol that night, so not fun. But I was over in Rayburn, so it wasn't, we were a little bit safer, but still, yeah. Troubling times, should all pray for our country. But aside from that, just a quick question, and I apologize if you had mentioned it earlier in your briefing. I've had conflicting Zoom calls going on here, but just want to make sure. I've had people reach out to me with the 8507 beds and some concerns about those, and just want to know where we're at with those as far as getting people into them, and then making sure that remains a priority for the judiciary.
It absolutely does, Senator Huff, and I explained this just a little while ago, but I'd be happy to explain it again. And that since the beginning of operations, we continue to do 8505 evaluations and 8507 placements. We work very closely and collaboratively with the Secretary of Health to establish telemedicine so that we could get some of these, at least, hearings done. As an interesting aside, it's working great. Individuals don't have to be transported for many of these hearings, and particularly for the individuals that may be determined to be incapable of going to trial, it seems to be just a great process that will probably keep going forever. the volume of everyone coming into the court on the criminal side is down, and some of the decisions by the state's attorneys to not prosecute certain offenses like drug crimes have resulted in a further reduction. But we still are doing them. As recently as Monday, I had verified that 2 individuals were placed from Prince George's County. The only hiccup sometimes that comes along is that wherever we're placing them, if there is some type of contagion going on at that moment, we have to delay, and we understand that, and the health department has been very great in explaining when that's happening to us and warning us. But it is still going, and we hope that no beds are lost over the course of this, and that when we come out, we can continue back, if we have the volume, obviously, to continue, and we'll still make it a priority.
All right, fantastic. Seeing no more questions. I will say just thank you all very much. We'll now move on to the next panel. Again, for Judge Ripken, congratulations. Definitely great news for us. So congratulations again. We'll now move on to the Department of Public Safety and Correctional Services, where we have Secretary Green. You were up next in the queue. Good to see you.
Very good, Senator. I believe my audio is unmuted.
There you go. I think we're good to go.
Very good. Thank you. Thank you for bringing up our slides. Good afternoon, Chairman Smith, Vice Chairman Wallstreicher, and members of the committee. For the record, my name is Robert Green. I'm the Secretary of the Department of Public Safety and Correctional Services. With me virtually today is Assistant Secretary of Programs, Treatment Services, Carolyn Scruggs, our Chief of Staff, Rachel Sessa, and from the Department of Health, Dr. Cliff Mitchell, Director of the Environmental Health Bureau, as well as Deputy Director Heather Shake. Next slide, please. Thank you. Today, I'm going to provide a brief update on the department's response to the continuing COVID-19 pandemic. As has been from day one, safety and security of the dedicated men and women who work for this department and the incarcerated population remains our absolute priority. The department has been and will continue to be extremely diligent and committed to our COVID-19 mitigation and response strategies, and we will continue to work very closely with the Department of Health to stop the spread of COVID-19 within our correctional system. Next slide, please. Thank you. A key element of our mitigation and prevention efforts has been increased utilization of our diversion programs. As you know, the department operates its own home detention program that supervises incarcerated individuals within our system who are approved for placement prior to the expiration of their sentence. Inmates and detainees are eligible for the home detention program at no cost. The Division of Corrections has the authority to approve or deny those placements. The department has been expediting the placement of incarcerated individuals within our system to home detention as an element of our population reduction strategy and good community reentry focus. As the chart illustrates, placements have increased by 155% compared to last calendar year. Next slide, please. Pretrial services is a function of local jails, and since the department is responsible for the Baltimore City Jail, we've also run a very successful pretrial supervision program in the city. After conducting interviews and investigations, the pretrial release supervision program provides recommendations to the courts concerning the pretrial release of individuals accused of crimes in Baltimore, and again, at no cost to them. This program has been nationally recognized for its successes, its low failure to appear rates, and rearrest rates of those under its supervision. As you can see, pretrial release supervision placements have increased by 160% since March of this year. It's important to note that most local jurisdictions also have statutory authority to establish home detention and pretrial release programs. Next slide, please. We would also like to give you an update on the results of these releases and their impact on our density reduction efforts. From March 1, 2020 to January 1st of 2021, there have been 15,487 individuals have been deflected or released from DPSCS custody, which greatly assists in the mitigation of COVID-19 risk in our population. 4,697 individuals have been released from booking in Baltimore City. 5,437 individuals were released from pretrial detention prior to sentencing, and 955 individuals were transferred from facilities into the custody of our home detention unit. 4,398 individuals were released from sentenced custody. Next slide, please. As you know, Maryland is at the forefront in terms of reducing its incarcerated population since the implementation of the Justice Reinvestment Act. Over the past year alone, the department's average daily population has declined nearly 12 times the rate compared to the same period of time last year. The current population is just over 18,000, and we are closely watching our population trends, and we're watching the data across both our jail and our DOC system. I would note that a significant portion of that population reduction has been within the DOC population. Next slide, please. In terms of COVID-19 testing, the department has dramatically expanded its capacity and protocols. The department first conducted tests of symptomatic inmates according to CDC and Maryland Health Department guidance. In accordance with the governor's announcement on May 20th and guidance issued by the CDC, shifts in testing methodology towards wide-scale targeted as well as asymptomatic testing began. Currently, the department is testing its facility staff on a monthly basis, with the exception of the Baltimore Central Booking and Intake Center, where staff are being tested on a weekly basis, as this is the point of entry into our system. We have also implemented a rapid test program at the Baltimore City and Intake Central Booking in recent weeks, where individuals are tested for COVID-19 prior to commitment. And I would note that this is prior to entry into our formal facility. It's done in a tent complex outside. The department is currently completing the 7th round of monthly staff testing. We've conducted 22 weeks of staff testing at the Baltimore Central Booking and Intake Center. The department also conducts serial testing of our incarcerated population on a weekly basis, and again, upon intake into our system, which obviously will include new intakes from our local jail colleagues. The department's inmate medical contractor has implemented targeted serial testing. Since that implementation date, 28,000 tests have been administered across the general population and chronic care subpopulations who obviously we are more closely monitoring. We are in our 18th week of serial testing the inmate population and have tested on average approximately 1,600 per week, including outbreak testing and court transfer testing, again related to court appearances. Next slide, please. This slide illustrates a bit of both the progression of our testing expansion as well as the total number of COVID tests that we have administered. To put a very fine point on it, Senators, as of January 4th, 2021, the department has administered over 90,000 COVID-19 tests. Next slide, please. This slide illustrates the positivity rate among correctional facility staff in comparison to the 7-day Maryland statewide community positivity rate. It is a bit of a busy slide. The orange X's is the community positivity rate, blue dots our facility staff positivity rate. We know that our staff are our most significant vectors of exposure, which is why we issued PPE very early in the pandemic. And we continue to track the spread of COVID-19 very closely via this very type of data. As of Monday, January 4th, the department has reported a total of 667 active COVID-19 cases. 307 of those active cases are among staff who are either on mandatory quarantine at home recovering. 360 active inmate cases who are quarantining and or receiving treatment in our facilities, in our hospital surge capacity tents, or perhaps in a community hospital. I would note that this data is available every week on Mondays and Fridays after 3 p.m. and it's publicly published data on our website. Next slide, please. According to the most recently released data of COVID-19, our infection rates based on the national inmate population, Maryland is ranked 30th in the nation for total COVID cases among inmates and 39th in the nation for cases per 10,000 inmates. Next slide, please. The department, we just continue to fight the spread and hold vital daily leadership meetings to ensure proper protocols are in place and they're being followed, and to address, quite frankly, any prevailing or evolving changes in fighting this pandemic. We've distributed an enormous amount of PPE to keep our staff and population safe, including nearly 600,000 bars of soap and nearly 100,000 face masks just among the inmate population alone. Again, in total, senators, we've distributed over 10 million pieces of PPE across our department, and will continue to do so to keep those in our custody and working for us safe. We've put in place COVID-19 compliance review teams and environmental safety officers. They remain in place at our facilities, and they've conducted about 133 multidisciplinary reviews to ensure that our staff are adhering to the COVID-19 policies and procedures, and we're doing what we say we're doing. These teams come in at multiple hours and anytime throughout the week. Early on, as we presented to you, we began to take swift action to prevent the spread, which includes the best practice of sanitation. We've tripled our sanitation, and as pictured on this slide, the department has conducted over 300 rounds of professional deep cleaning throughout our facilities and offices, and this has been one of our key practices. We've identified zones in our correctional facilities for the purposes of cohorting the incarcerated population and controlling movement, which is a key piece of, again, fighting this spread. We have negative airflow housing units, dedicated isolation and quarantine space, and we monitor the utilization of that bed space and those movements on a daily, if not at times, hourly basis. I would tell you Maryland was one of the first states in the nation to deploy hospital tents to its correctional facilities as a proactive component of the Maryland Department of Health statewide surge plan, which you will see pictured here. These tents are, located at Jessup and Hagerstown, and they provide a level of elevated COVID-19 treatment to those who are convalescent, but do not require intensive care. And thus we are reducing our impact on the local hospital systems. Next slide, please. I'm also pleased that, as announced during the governor's press conference on the 5th, January 5th, public safety and corrections is included in the phase 1 of the vaccination priority plan. Specifically, phase 1 includes medical personnel working in correctional facilities and our correctional facility staff. Phase 1B will include the incarcerated population who are older than 75 years of age. The department received its first delivery of vaccinations Wednesday, January 6th, and we vaccinated the vaccinators that very same day. We have an aggressive schedule that we are rolling out through departmental operated clinics, and they will begin tomorrow at 7 a.m. and will continue without delay as our vaccination supply allows. To close up, Senator, I'd be very remiss if I didn't also mention that despite these tremendous challenging times, we've continued to address our hiring and recruitment needs of essential personnel. We've surpassed our 2019 levels, and as of the end of December, the department has hired approximately 703 new employees, 491 of which are correctional officers. We've safely completed 11 academy classes across the state, which we cannot find the last time that we've done so at this rate. And again, in 2021, we will hope to continue to surpass those figures. I would tell you that the department's response and efforts against COVID-19 have been and will continue to be a tremendous effort for us. I'm truly proud of the men and women, the managers, that work within this department, their sacrifices and their tireless work as we continue to chart an uncharted journey. And I too would be remiss if I did not give credit to the collaboration of our fellow state agencies, our colleagues at MDH, the courts, and many other departments that help us be incredibly successful in the work that we do, and I would say collaborative and innovative. And I'd be pleased to answer any questions that the committee would have at the appropriate time, Senator Smith.
All right, fantastic. Thank you, Secretary Green. Is there anyone else on your team? We've on the agenda, we have Ms. Scruggs and Ms. Sessa and Mr. Mitchell. Do you want them to go in any particular order?
Senator Smith, they were here to support in the event there were any questions that the committee may have beyond that which we explained in our testimony.
Fantastic. Well, thank you for the update and for your fantastic work. We're going to hold off on questions until the very end for the committee members. So just thanks again for this information, and this is great. So we'll move on to the next panel, the Department of Juvenile Services, Secretary Abed. How are you? Good afternoon, sir. All right, let me grab, let's ask. All right, go ahead. You're still muted here. There you go.
Okay. There we go. All right, I got a little okay screen. Sorry, Mr. Chairman, thank you. Mr. Vice Chairman, for having me. I am doing well. And it's a pleasure to be here to update you on our efforts at DJS. Let's go ahead and go into the next slide. I think, very similar to what you heard from Secretary Green at Public Safety, a lot of the same strategies we have used. I'll admit that I consulted with Secretary Green many times throughout this pandemic to find out what they were doing and compare our plans or just go ahead and take some things that they were doing that they thought that were good ideas. And I'll join in his recognition of the collaboration between agencies, between state agencies, between the judiciary and the courts and the practitioners in the court. I think those have been critical to our success moving through this. A lot of the things here, I think we've gone over. I think what I'll highlight are some of the things that are a little bit different. We did have to change some of our group living strategies, particularly at youth camps, where we don't have individual living rooms, where we have, sort of group areas and dormitory style living. So we had to procure some extra space and keep kids separately with different bathrooms, and then also organize our staffing so that staff did not float from group to group. And we had very segregated groups so that if there were outbreaks, they would be contained within those groups. Another thing I wanted to highlight on this particular one was the preparation of a supplemental workforce. We did not end up, at least at this point, having to utilize this supplemental workforce, but I think more than 150 of our community staff came forward and volunteered to be trained as correctional or as a resident advisor to provide security services within the facilities if needed, in case we had a lot of staff go out. Fortunately, we never had to activate that plan, but it's, I think, something worth noting. Let's go to the next slide. These are some of the activities that we developed in the community side of the house. And most of the community supervision that we conduct now is virtual. There are occasions where we do need to come and have a face or socially distanced, but face-to-face contact, and working with our providers in the community to develop virtual programming with our kids. I think one of the things that I want to highlight here is training our staff on the supports that were put up by the government during the pandemic, particularly with schools being closed, directing young people and their families to where they can get resources for for food or for nutrition or other resources that perhaps social services or the health department was providing. And then, the weekly placement and detention reviews, I think the additional oversight, as we'll see, was key to helping us safely reduce the population. I want to note one other piece here on the 24/7 operations in the community. Sometimes this gets overlooked, but in addition to our facilities being 24/7, we still operate in the community with our community detention workers who supervise kids that are on electronic monitoring or home detention, and have to respond if there is a need to respond within the community. And those folks continue to operate and have done a fantastic job for us, along with our entire staff. Let's go to the next slide. So here we're highlighting some of our communication strategies. These things were if you start at the right of the screen, this hotline was probably the first thing we stood up to get information to folks. They had to dial into the hotline. Since then, we have now posted on our website and update regularly. Most of the data is updated daily so that folks can see where exactly we have any positive cases or if we have positive youth. And then outside of the facilities themselves, we actually post signs up in case people haven't gone in and looked at the data or somehow didn't find otherwise. They'll see when they come to the front door exactly which living units have any positive COVID cases so that they can take appropriate precautions. The stakeholder calls with whether it's the judiciary, whether stakeholders like the court practitioners, the legislature, these I think were very important in coordinating our efforts to keep the system moving. And then the same type of model was used to communicate with our staff and with our family members. And it was really important to be able to answer questions, particularly early on when we had to take some very drastic actions like limiting who could come into the facilities, including parents, and explaining to them why we had to do it, why the health emergency really dictated those changes, and what we could do in terms of enhanced phone calls, video calls, and other things to try to keep them connected with their kids and just answer their questions, because we knew they would have a tremendous amount of anxiety. And same for our staff to be able to be responsive to them in a format that allows a question and answer so they can understand what we're doing and why we're doing it. Next slide. So when we look at the population and looking at this slide and the next one, we'll kind of look at them together. What we see is a very sharp decline in our population. Complaints, and I think this has been detailed in the judiciary presentation first. The number of complaints, this is the charges that we get for kids, have dropped significantly, 68% since January. And that will have a tremendous impact on our populations in detention and commitment. Detention is down 47%, and then the committed population is down 59%. Earlier in the pandemic, we saw, and you see now, a temporary decline in youth of color in the detention population. I thought that was significant at the time because all of our prior efforts to try to mitigate race disparities had not worked. And it appeared that there was a sustained decline in the detention population. Unfortunately, as we look at the data and as it's worn on over the last few months, that has regressed back to near where it was pre-COVID. There is still a decline in the proportion of youth of color in the committed programs, but I suspect that that's still there because it is a lagging sort of indicator. The detention population will move before the committed population does. So it's disappointing, but nevertheless, we need to continue our efforts in trying to mitigate those disparities. Next slide. This is a snapshot of our detention population, and the little people that are referenced by the colors there are indicating the total population. So if you look at the left side versus the right side of the screen, the left side, you see that there was a population decline of all of the categories that we're listing here: violations of probation, misdemeanors, nonviolent felonies, and crimes of violence. So overall, everything went down. But when you look at the right side of the screen here, you can see on the bar graph that the proportion, this is looking at the proportion of that remaining population, has changed. And the biggest changes are at the top and the bottom of the graph. Violations of probation, and those are, to be clear, technical violations of probation, not new offense, but technical violations of probation resulting in detention have declined significantly. And the proportion of youth detained for a crime of violence has increased significantly. And I think those are very good things. Those are the kinds of things that we would want to see in a reform of our system, that we would have fewer kids that are there for technical violations or for lower level offenses, and a higher proportion of our population be there for crimes of violence, because those are the types of offenses that we should be using detention for. Next slide. So I get asked oftentimes, why was there such a big decline? I think we saw in the data, of course, that the number of charges declined significantly, and that's a very powerful piece of it and can't be ignored. But in addition to that, I think that some things I would want to highlight is that those effective communication strategies have led to really good collaboration between the departments, local state's attorneys, and public defenders and the courts. And I suspect that with everybody prioritizing health and the well-being of young people, that the decisions have changed, and that's why we see the different proportion. If it just declined because of arrests, I don't think we would see the change in proportion, but I think there is a change in the way that the courts and the practitioners are looking at these different cases. We also, I think I cannot overlook the Office of Public Defender's motion and the subsequent administrative order. That certainly had an impact, and it was a very well-written order. And I don't know if the Chief Judge is still on, but I would just compliment her and her team for thinking clearly through what the main concerns were, which were health, public health, and the health and welfare of our kids and our staff. And the reduction in population that was achieved in large part because of those changes. Not only I think were the way you would want to do it if you were doing reform. In other words, if you're going to reduce the population, you should reduce the lowest level youth and prioritize keeping kids that were the highest risk to community safety. And that's how it is breaking down. Next slide. So with regard to testing, we do universal testing of our staff generally monthly, and that's done in coordination with the health department. And then, of course, if there are outbreaks, if there are any need to do additional testing, we may come back and do a facility again within a week. We may do the whole facility. If there's only an outbreak in a certain area, we may do that area. And we'll do it again and again until the health officials tell us we don't need to any longer. And then with regards to our kids, we have a system of youth. When they get admitted to our detention centers, they are admitted to an admission quarantine unit. And so everybody gets tested as soon as they come into the facility. But as you know, we have an incubation period for COVID. So we keep them in this admission quarantine unit and then test them again approximately a week later to account for that incubation period. After 2 weeks, if we've got no symptoms and no positive tests, then the youth can move into the general population and be admitted. So anytime we want to move a kid, we will test them again prior to their moving. And then sometimes, we put this last one in here, test as directed by the medical team. Sometimes our medical staff just are suspicious of one thing or another and ask for a test. And I don't know how to account for that other than, we're going to err on the side of caution. And if a nurse or a doctor says, we tested this person yesterday and they were negative, or we tested them last week and they're negative, but I still think they may be positive, we may test them again. Or we think that the test didn't work, or maybe there was some other problem. We will follow the advice of our medical team. Next slide. So this is just looking at the total number of tests. This is as of January 4th. We've given 1,749 total tests to kids, and we've had 39 positive results. And we've given about 7,500 tests for staff with 229 positive results. And I know that there were questions about the vaccine rollout. Let me say, was there one more slide? I think this was the last slide. Okay, I'm going to assume that it is the last slide.
It appears to be the last slide.
Okay, great. I don't have it in front of me, so I have to rely on my memory here. We have as well started vaccines for primarily the people that have gotten it so far are our health team. Health staff have gotten it through the local health departments, and we are working with the health department as well to receive a vaccine ourselves and roll it out. I don't have a date yet for when we will receive it, but I think that we're very close to that. But in the meantime, our sort of frontline health staff are already being vaccinated through the local health departments while we roll that plan out. And I would just add that in anticipation of the vaccine, we also did some surveys of our staff, and a large number, only about 33% actually, responded that they would take the vaccine. So we are also engaged in a public relations strategy, trying to develop a plan to convince our staff to take the vaccine. I think that's going to be a big challenge. With that, I'll conclude and take any questions.
Thank you, Secretary Abed. We're going to actually hold off on questions until the end of the panel. So thank you very much for this presentation and the information. We'll next move on to the Office of Public Defender, Mr. DeWolf. Good to see you.
Trying to unmute here. Good to see you, Mr. Chairman, Chairman Smith, Vice Chair Waldstreicher, members of the committee. I appreciate the opportunity to present the Office of the Public Defender's response to the pandemic. Some of you may know that we are a statewide agency. We have 50 offices throughout the state. Our staff consists of 561 lawyers, 350 core staff, which includes administrative staff, social workers, and investigators. Since the beginning of the pandemic, we have successfully pivoted from those 50 offices to an almost exclusively work from home virtual workday environment. Laptops were deployed to our attorneys. Desktops and laptops are continuing to be deployed to our core staff to assist them in working virtually. Virtual platforms were set up to meet with clients in jails and prisons. We've been working very closely with Secretary Green and his staff, his IT staff, to set up virtual platforms in most of the prisons. We've been working with local jails and wardens of the local jails so that we can establish platforms so that attorney-client conversations can be had regularly and confidentially. It's still a work in progress, but many of the local jails have been quite cooperative, and we've been able to establish these platforms. During the pandemic, we were able to roll out our new case management system to improve case flow and data tracking. Our e-defender system is now up and running. Some of you may know that in March, about the same time the pandemic hit the world, our office was hit with a severe malware attack. Our computers and our servers were compromised across the state. With the help of DO-IT, the Department of Information Technology, we were able to rebuild our network and transition to a new platform of emails and to a virtual private network access. It has been a Herculean task by our IT staff, but we were able to rebuild all our servers, and because we had some backups, we were able to recapture our data. I can say our training division has seamlessly pivoted from an in-person training to train 560 lawyers. Although the Maryland Bar does not require mandatory CLE, we have an internal policy of requiring at least 12 hours of continuing legal education for all of our attorneys. Previously, we were training our attorneys in person. Now we have pivoted to a 100% virtual platform training. We've been able to make use of national programs such as the National Association for Public Defense and the National Criminal Lawyers Association to assist with training our attorneys and for them to meet their CLE requirements. As with every agency, COVID infections continue to grow. Our agency has seen 360 exposures that required quarantining of staff. 28 of our employees have tested positive. We are now experiencing about an average of 1 or 2 positive tested employees per day. But because most of our employees are working from home, we have not experienced the extreme expense of sanitizing and cleaning entire offices as we did at the beginning of the pandemic. Of course, our biggest concern is for the health and safety of our employees and our clients who are attending in-person trials and hearings in the various courthouses. We've heard previously about the number of in-person trials. It's primarily a district court concern. The circuit court are handling, since they have stopped having jury trials, a lot of the hearings, motions hearings and others, plea hearings, are able to be conducted remotely. Our ability to conduct remote hearings is improving all the time. Our mental health division, our parental defense division are conducting virtual hearings in all cases. Our appellate division, as Judge Barbera has said, all hearings are now done on a virtual platform, and that has been quite successful. I have to say, Mr. Chairman, that I am extremely proud of the nearly 1,000 employees at the Office of the Public Defender and their response to the COVID-19 challenges. I think it was done with a degree of consistency, and they've all worked extremely hard to make this happen. And I'm very proud of our ability to have done so. And I'm happy to answer any questions that the committee may have.
Well, thank you very much, Mr. DeWolf, and thank you for your work and everyone that works with your office. Just tremendous work. So thank you very much for everything you've done, especially in the midst of the pandemic. And next we will have, I see Mr. DeLeonardo there. There you go. How are you, sir? From the Maryland States Attorneys Association. You are up next. And then Senator Lee, I saw your question, but we're going to ask, we'll get you at the end. Got you.
Good opportunity to go. Good afternoon, Chairman Smith, members of the Judicial Proceedings Committee. It is my privilege to have the opportunity to appear as State's Attorney for Carroll County, but also President of the Maryland State's Attorneys Association represents all of the state's attorneys, along with 642 prosecutors and employees, staff, investigators, paralegals, victim advocates, and all these various offices. As I start, though, I do want to say, and perhaps in Carol, we very much have seen this, is to thank all the healthcare workers, our health departments, EMS, our hospitals, and staff has been incredibly strained and overworked. Many of you may remember at the very early days of the pandemic arriving in Maryland, Carol ourselves actually saw one of the very early and worst examples in our nursing home. In a very short time, we had dozens, I mean literally dozens of patients that had been lose their life. So we certainly are very aware of that. I wanted to at least touch on it. Certainly, the pandemic has touched all of it. Everyone has had some loss along the way, and so I wanted to at least acknowledge that as I get into the challenges we've faced, prosecutors. Some of the challenges and how we've done. Certainly, the transitioning to remote working, as well as modification of workspaces. Our offices, as many, we're not set up for that. We're a people business, and we have many offices around the state that shared offices, situations where there are many employees in one workspace. That created challenges. We had challenges with getting laptops and other equipment that could be used, and it was unsafe for employees to be in the space. That was something that many of the state's attorneys that we've discussed and shared had to act very quickly, and it was very creative in getting enough laptops in order for everyone to be able to work remotely. We've certainly gone to staggered rotation, coming in court, limited numbers that were in court, but this has certainly been ever evolving as new data and new court orders. Our priority has always been to keep staff safe, keep the victims and witnesses we work with safe, as well as making sure that we maintain really the core functions that we have. Senator Carter brought up, it's been touched on with a few, regarding some of the inconsistent applications. I was actually yesterday, all of our elected state's attorneys was on the call, and I will tell you that what I hear from around the state, circuit court has been very consistent. Mr. DeWolf also knows. Circuit court has been very consistent in terms of limiting of the numbers of cases, safe in that regard. I will tell you that I hear very much from my colleagues around the state. The district court, however, is very inconsistent. There are times when certain jurisdictions have a limited number of cases that they set per hour to minimize the number of people in, where others may have 30 cases on a docket. And one of the challenges with that is, while the courtroom itself may only have a particular case in there at one time, and people are protected by plexiglass and so forth, the waiting area, the lobby, that can become a really difficult place. I've heard from one of my colleagues a situation where, you have people that come in that, some that we deal with have drug addiction, some have alcohol issues. They may not be necessarily practicing all of the recommendations that we have to do for protect each other. And some of them have turned out to be positive. Some come in sick. And while I think our courts are doing everything they can, people coming in, that's just a reality of something we face. So I will say that is an area for improvement, I think, and I recognize courts, it is an incredible challenge. We work, all of the state attorneys work with our local courts, and I think we've had very good communication. Some of the orders that allow flexibility to local judges, it's certainly appreciated and it's understood. That can be really helpful. It can also somewhat be a drawback, however, because some may have differing views on how much we should do. So I do think that's important that we keep in mind. That consistency is difficult because in the same office, you have not many cases very distant in one courtroom, but in a different courtroom, it is quite a different matter. So I think that is something that my colleagues have shared and wanted me to share. A couple other quick things. Have really, our offices have really worked a lot with our health department, our jails. I can tell you, when this began, my office and many of my colleagues, the very first thing we did was we got a jail. And we went through and we looked at everyone that we could safely and appropriately place somewhere, especially when we knew some of the cases were not going to be heard in a timely fashion. You had a lot of cases that, for example, they would have served the appropriate time had they gone to court, and they didn't, and we get them out. We actually looked at those cases, and my colleagues did it as well. We actually would call the defense attorneys and say, hey, we need you to file something to do that. We did that and certainly to aid in our jails. Many of our jails were in a position of trying to set up isolation areas, and certainly reducing capacity was incredibly important for not only the safety of those that were being housed there, the workers there, but also courthouse staff. People are going back and forth. So I think we did a tremendous job, and as you saw even with some of the numbers, we do it with the state as well in working with them. We also worked in terms of with our health departments in enforcing governor's orders. We've had various situations around the state. In order to gain compliance that's necessary to keep all of this safe, we have worked with our health departments and our police. Lastly, and I think this is one of the positives for those in a situation like this, I think we have been pressed to do a lot to be creative to serve the community. Many times people don't realize that state's attorney's office, we're prosecutors, but prosecution is only one function of obviously the role that we play in the community. We have, for example, I'll use myself, I actually have a person in long-term recovery that I hired when I first was elected that works really proactively get people. And so we have our own diversion. And that was something when suddenly you couldn't meet and you couldn't interact with people, that we had to find ways to get around, and we obviously have done that virtually. We have been very concerned with victims of crime, domestic violence, child abuse, both in particular. Domestic violence because we ran into situations where we had people that had domestic violence cases that were suddenly under stay-at-home orders that are staying at home with the person that had abused them. That was a very big issue, and both myself and colleagues, something we shared, half the Maryland State's Attorneys Association. I actually did a PSA with the House of Ruth to try to inform victims that were out there that there were services. Because sometimes in the messaging, we hear courts are closed. But in reality, as JPR pointed out, there was still the core essential services available. So we did much when it came to that. We typically have had drug overdose memorials. Have every year. I've had my previous one is close to 500 people in attendance. We obviously cannot do that. So you have seen both myself and other places looking to the virtual memorials. And importantly for all of our prosecutors, our association has rolled out virtual training that have been very important and timely for a lot of our prosecutors. So that whether it is hearing updates from our Attorney General's office, or learning some of the latest issues that are, how to address them in court, we have actually gone to the ability of having virtual training to be offered for prosecutors statewide instead of every. Lastly, our school programs is something else. We've seen our children being unable to attend school. That has been a source of concern, again, when I talk about child abuse or neglect, not having the intervention of school. So we have been reaching out in cooperation with our schools for virtual programs with the hope that they recognize and certainly scholars recognize that they are not alone. There are resources available. So with that, thank you very much for all of your interest in this issue, and I'll stand for questions.
Well, thank you very much, Mr. DiLeonardo, and especially thank you for your public service, and especially what you've had to do to adapt to the new realities of the pandemic with respect to, especially for victims of domestic violence. So thank you for that. Next, we will we'll turn to Chief Neske from the Maryland Chiefs of Police Association. Is Chief Neske there? I see Chief Morris. How are you?
I'm doing well, sir. Good afternoon, Mr. Chairman, Vice Chair Wallstreicher, members of the committee. On behalf of the Maryland Chiefs and Sheriffs, we want to extend our thanks and appreciation for the opportunity to participate today and provide a brief update. And I want to extend the regrets of Chief Neske, the president of the Maryland Chiefs, for his inability to be here today. He was scheduled to be here, but he had a family issue that arose and he needed to attend to. So unfortunately, Mr. Chair, you've got the second string filling in, but I'll do the best I can. Obviously, our law enforcement members are not cannot remote work. So our officers and our deputies and our troopers remain on the front line, providing our core mission of responding to emergency calls for service, as well as promoting traffic safety measures that are important to continue to reduce traffic fatalities that we've seen rise both here in the state as well as nationally. And in particular, participating with our allied agencies at all levels and our community leaders with an emphasis on reducing crimes of violence that continue to threaten our most vulnerable communities. In response to the ongoing pandemic, the chiefs and sheriffs continue to work very closely with local and state law enforcement agencies, as well as with our respective health departments and the offices of emergency management and preparedness to ensure a coordinated public safety response. We continue to receive very timely and effective updates from the Maryland State Police with regards to the executive orders of the governor, as well as the local executive orders from the county executives, with the idea and the emphasis to provide a consistent approach to enforcement regardless of jurisdiction, while prescribing to the necessary safety practices and precautions. As it relates to enforcement, which I mentioned, of both the executive orders from our governor as well as at the local level from our county executives, our goal continues to be to educate, and when all else fails, educate, with the anticipated outcome of achieving voluntary compliance with the executive orders, as well as maintaining CDC guidelines. The vaccinations, we know, have begun in some jurisdictions, a little slower to roll out in others. That is only to say that we recognize the challenges associated with these programs, and we know that our health departments are working very, very hard to get the vaccinations out to all of our frontline first responders, healthcare workers, and so forth. Despite the myriad challenges that we are confronting, please know that we remain committed to providing nothing less than professional and effective services that are intended to protect our communities from those that would cause harm. And with that, Mr. Chair, I'll be here to answer any questions at the conclusion of the presentation.
Thank you, Chief. Well, Happy New Year. Good to see you. And thank you, as always, for everything you do to keep us safe. So good to see you.
Thank you. Pleasure, sir.
There you go. Next, we'll move off to here we go, the Maryland Sheriff's Association.
Thank you, Vice Chairman Smith. And I guess I'll say that Chief Morris, my good friend, Chief Dave Morris, took a lot of our thunder, but we'll certainly provide you a quick, brief update. And it's Friday, so I'll go fast so we can get everybody out of here on time.
Much appreciated.
You got it, Chairman. So let me first thank you, Chairman Smith, for having us here today, and Vice Chairman Waldstreicher and the members of JPR. Maryland sheriffs throughout Maryland are continuing to find unique ways to maintain our normal operations and activities through these challenging and unique public health times. Our deputies are continuing to provide all customary law enforcement activities, interacting with the public in a safe and professional and effective manner. We're finding most of our sheriff's offices are ensuring patrol deputies are properly protecting themselves and the public, while ensuring officers and the public safety is of the paramount importance. Chief Morris touched on the governor's orders a little bit. I'll also touch on those and reiterate his comments of saying that's what we are doing as well. Educate, educate, educate. The goal is to make sure that we're trying to bring the public in compliance and make sure that everybody's as safe as possible while educating folks and not overreaching. Our Maryland 24 Maryland sheriffs continue to meet quite regularly and share best practices and discussions on how best we can handle the pandemic as we continue to move forward. I know State's Attorney DiLeonardo, who went before us, he had his PSA on domestic violence. I'll give our PSA from the sheriffs on traffic enforcement. We have continued to see Maryland drivers exceeding speed limits by 20, 30, 40 miles per hour, creating dangerous situations on our roadways. My advice to Maryland drivers are, while there are not as many cars on the roadways as we normally see at this time of year, our police officers, our deputies, and our troopers are still out there, and they will be issuing citations, and they will be ensuring compliance to limit those traffic accidents and to limit those deadly interactions. Here in Hartford County, we've seen about 10% of our workforce, and that's pretty standard with most of our sheriff's offices across the state. About 10% of our workforce have contracted the COVID virus. Fortunately, in most all of these cases, they've been very mild cases with symptoms that have allowed these individuals to return to work within 10 to 14 days, or once they've received their negative test. Our sheriff's deputies, correctional officers, and 911 dispatchers and civilians are beginning this week to see the rollouts of the vaccination. Many county sheriffs have reported vaccinations are beginning this week, and we're seeing anywhere from as low as 25% of the workforce that have taken advantage and signed up to get these vaccinations. To here in Hartford County, we've had about a third of our workforce that have decided they want to go ahead and go forth and get this vaccination at this time. So, Vice Chairman Smith, we appreciate everything that you guys are doing down there in Annapolis. I would say I look forward to seeing you next week in person, but as you know, we'll be continuing to meet via these Zoom meetings for the foreseeable future. So thank you again, sir, for everything you're doing.
That's right. Well, I appreciate it, and likewise, and thank you for everything you're doing. And as folks continue to get the vaccination, hopefully we'll be on a road to normalcy pretty soon. Hopefully this is the beginning of the end. So thank you very much. Next, we will move on to the Maryland Correctional Administrators Association. We have Major Reese. Let me see if I see over there.
Am I unmuted?
You are unmuted.
I wonder why my camera's not showing up. Good afternoon, Chairman Smith, members of the Judicial Proceedings Committee. I'm Major T.D. Reese, Administrator of the Calvert County Detention Center and current President of the Maryland Correctional Administrators Association. We thank you for allowing us to speak this afternoon and give you an update on the local jails. Do I need to do something to turn this camera on for you?
No, we are good to go unless you have a presentation. I think we'd love to see your face, but we're okay. We can hear you.
Let me see if this works.
Oh, there you go.
There we go. Well, back in March, as a response to the COVID-19 pandemic, the MCAA began to conduct weekly conference calls involving all the local jail wardens and the Maryland Division of Corrections. And we continue now with this conference call every other Tuesday. And, you know, we owe a great debt of gratitude to Secretary Green, who personally, along with his staff, attends these calls faithfully. The Division of Corrections has provided invaluable information to us to assist us in our response to the pandemic. Thank you to Secretary Green and your staff. I would also like to mention that the Maryland Department of Health, and thank you to Dr. Mitchell, as well as other local jails and organizations from Pennsylvania and New Jersey, and thank them for their help as well. This collaboration of all of us providing experiences, information, and suggestions, I feel is what has kept us out in front of the pandemic in our response. There have been a lot of changes that occurred at a rapid pace in local jails. And most are still in place, and they will remain in place for some time to ensure the safety of our inmate population and our staff. All jails continue to require masks to be worn on all persons at all times while in the facility. All jails continue to require quarantine of all new inmates for at least 14 days upon arrival. The cleaning, sanitation of facilities, and the use of PPE has been taken to a whole new level in all facilities across the state. The COVID testing of inmates continues to increase, with a few local jails having the ability to test all new inmates for COVID-19 at intake. And other jails are testing based on the COVID-19 protocols determined by their medical contractor and or their local health department at intake. Overall jail populations from October of 2019 to November of 2020 have on an average decreased by nearly 11%, while the use of pretrial release on average across the state is up close to 40%. The use of home detention is also up close to 40% over the same time period. However, even with the decrease in our overall population, the responsibility to quarantine all new inmates and the need for facilities to maintain a COVID isolation unit as a response to the pandemic has resulted in local jails having less bed space available for general population than we did pre-pandemic. We've seen an increase in the intake of individuals with mental health needs. Outbreaks at the state hospitals have resulted in a backup of transportation of these individuals, but the Department of Mental Health has been working good with local jails in arranging these transports and moving them when they can. Most of the jails have returned to conducting inmate programs for their population using video and other technologies to provide substance abuse, educational, religious, and other programs. Work release programs across the state remain to be shut down. There are a few jails, 3 of them that have reported to me have returned to allowing weekend sentences, but I believe these facilities have an off-site place where they report. They're not reporting in and out of the facility. Visiting in most jails is being conducted either by no contact on a pre-scheduled visit or remotely by use of video visitation. Courts and attorney visits, have you just heard in depth, we continue to operate mostly by remote use of video. Jails across the state are beginning to roll out the vaccination for their inmate population and their staff. Some have already begun, and the remainder will be starting very soon. From what I've been able to gather in talking and on our weekly phone calls, the participation thus far is probably less than 50% in both groups, just on an average, both staff and inmates in those willing to volunteer to take the vaccination. Well, one of the continued frustrations is the availability of testing for staff who may have been exposed to COVID-19. The means to be able to determine the staff's exposure is critical to not only properly staffing our facilities, but also to begin the proper contact tracing. The availability of the tests is a problem, as well as the length of time in getting the results back is also an issue at the local jail level. A lot of jails have great assistance, whatever, from the health departments and are able to get these tests whenever they ask for them. But a lot of us, probably the smaller, more rural jurisdictions, we're not as fortunate. We're told to have them go see their doctor, basically. And that whole process just takes a long time, and we need them staff back to work. So that's probably our biggest frustration. I mean, obviously, I appreciate everybody pulling together and helping each other out through this pandemic. And I'm sure that'll continue throughout. So that's all I have. I appreciate the opportunity to present, and I'll be glad to take any questions at the end. I believe I am the end. So
there you go. Well, thank you, Major Reese. I appreciate the information and most useful and helpful. So thank you very much for your time today. I'm going to look around the room. I know Senator Lee had a question. So we'll start off with you, Senator Lee. You have the floor.
Okay, can you hear me? Thank you, Mr. Chairman. I'd like to thank everyone for these wonderful presentations. we're living in a new norm right now, and there's been a lot of really difficult and challenging things that we've had to overcome. But now with more of the use of telework and also remote hearings being conducted and everybody working remotely, I think that this is probably going to continue even after the pandemic. But I just wanted to ask the different agencies, particularly state's attorneys and the public defender's office, particularly public defender, when your systems were attacked by malware, was it ransomware that was attacked? Was it the use of ransomware or some other kind of hacking? And do you think that have you increased your resources to update your computer systems and your networks so to be proactive in terms of preventing some of this hacking that's going on, particularly with the increased use in remote hearings and many of us now working by remotely as well? And also, are you doing training for staff with regard to computer hygiene? You know, because a lot of the hacking occurs because perhaps, you know, some of the staff unintentionally they were working on their computer and they kind of let something in, and the next thing you know, the whole system's been invaded. So I think we could start with the public defender. And thank you for all that you've all done under these most trying of circumstances, because it looks like everyone's been able to operate and serve the people of Maryland very efficiently and done so remotely.
Thank you, Senator Lee. Yes, as a matter of fact, it was a ransomware attack and a very serious one. Fortunately, we had a backup server that was clean, and we were able to rebuild our other servers and computers, shutting everything down and rebuilding them all from scratch. We had some great help from the State Department of Information Technology, and we were able to get some additional resources. And in the long run, our platforms are safer, our servers are safer. To answer your question, we are doing training. Our IT department sends out at least once a month some testing that we all have to complete and pass in order to be certified. And so that's been a big help as well. And people were talking about cooperation, the cooperation that we received from the courts and from the Department of Information Technology, from the governor's office, has been tremendous. So we're back up and running, and I think we're more secure and we're stronger than we were before. And frankly, it helped us because having to rebuild our computers, we were able to roll out new laptops and deploy them in a much safer way. So I think we're better off than we were before in terms of.
I guess it exposed some of your vulnerabilities as well.
Yeah, it did, and I think all of us can probably learn safety techniques in just turning your computer on and answering emails and opening up emails and which ones to avoid. So
are you updating and expanding resources for your IT updates, or like your IT department? Because that's
yes, yeah, we have deployed, and I'm not an IT person, so I'll probably, but we have deployed new safety measures. I know our servers are more secure. Our techniques, we're learning from our IT department what techniques we need to comply with in order to work safely. But we're all working virtually now, and we're meeting with our clients virtually, even in jails. And the platforms seem to be working, and our training division is doing a wonderful job across the state in keeping up with our training needs. I think in a lot of ways, and we rolled out a new case management system that helps us with our producing data and analytics. So it's all good.
Well,
Thank you for the
so
question.
much, because ransomware is very destructive. And in some cases with some entities, including some of our municipalities, which you heard about like in 2019, they didn't even get some of their data recovered. And it cost over $15 million just to repair, and probably the cost is even greater than that we just don't know about. But the more critical thing is attacking like your office or state's attorneys or law enforcement, which
We were very fortunate. We didn't lose
yeah, so you're very fortunate, but thank you for your work in that. Thank you.
All right, excellent. I know that Senator Hettleman has a question.
Thank you very much, Mr. Chairman. And I don't know if this is most appropriate for the judiciary or maybe DPSCS, but you all discussed the rising numbers of people who are being detained at home and pretrial supervision. And I'm just wondering whether there are any plans to address some of these issues, and whether there is consideration of more active compassionate release for the elderly, or misdemeanor amnesty, or anything of the like that could kind of address those issues. If you could respond to that, I'd appreciate it. Thanks.
Senator, would you like to hear from the judiciary first? I believe they might not be there. Okay. Thank you for that question, Senator. I will answer what I can. Our home detention program, again, is for sentenced populations. We were previously in a catchment area of 7 jurisdictions. We have expanded that statewide, and quite frankly, Senator, that was part of a plan pre-pandemic to broaden our re-entry services across the state. So again, I would say the pandemic expedited that and has allowed us to do so. In terms of release, we have exercised 2 executive orders around release, and we can provide you the data on that. The second has not yet been completed.
Just one follow-up too, and I think I see Judge Morrissey, so maybe he can address that issue too. But I want to get back to Secretary Green also. Maybe I missed it in your presentation, but did you talk about vaccination protocols that are happening within your population, both staff and those incarcerated? If you could address that, I'd appreciate it.
I did, Senator, but I'd be happy to repeat. We are, as of the governor's announcement on January 5th, we are in A1, 1A for our correctional line staff, 1B for those individuals in our congregate care environments over 75 years of age. We received our first vaccinations on Wednesday. In terms of our supply, we vaccinated the vaccinators that very day in our first clinic. And we are going to, as a department, roll out clinics across all of our regions. Our first one will begin 7 a.m. Saturday morning.
Thank you.
And then, again, the vaccinations with our inmate population will be handled by our contract vendor. And again, will be part of that 1B vaccination rollout as well.
And do you know how many do you have? How many doses?
We've gotten a supply to be able to get started. It is not a complete supply. We'll be required to use 75% of that supply so we can get more.
Right, but I know that the doses that have been coming into the state are limited. They're around 72,000, as I understand, for the entire state. So I'm just curious what part of that piece of that is to you, or whether you're part of the CVS Walgreens.
We are not part of the CVS Walgreens. Ours is a redistribution from a health department for us to do our clinics and serve the entire state.
So do you have a figure on that?
We got 1,950 doses to begin.
Okay, thank you.
Yes, Senator.
Senator, this is Judge Morrissey. In answer to part of your question, the way that pretrial works and our ability to send people to home detention is dependent upon the authorizing statutes of the local jurisdictions. There are certain jurisdictions that are either mandated or have the permission to create these. The one issue that we're running into is that in certain jurisdictions, those programs do not permit offenders that are charged with certain violent crimes or escape or several other things. That creates a problem for the judiciary, because if the population of individuals are being arrested are less, what we're seeing is that the charges are more serious. The low-hanging fruit, if you will, is no longer being arrested. They may be given citations, I don't know, but they're not being brought to a commissioner that would result in incarceration. But therefore, there's a kind of a self-selection of a more serious group of people that are being detained. And if the court can't send them to home detention, they're limited. As to any type of amnesty program, that is not within the authority of the court to do something like that. We're bound by statutes and regulations, and it would be impermissible for us to do that. With that said, Chief Judge Barbera, in one of her administrative orders, has asked us to look at these in light of the COVID and what's going on right now, and we have been doing that. Every court's administrative judge reviews the list of those still detained every week and makes determinations. And I can tell you that our release rates are just, they're up considerably over what they were before in terms of re-reviews of bail.
And one more follow-up, if I may, Mr. Chairman. And is this something you're also working with the Office of the Public Defender? I assume they're submitting names of people for consideration for compassionate release as well. And I assume that would be governed by each jurisdiction's rules on that too.
Compassionate release isn't, I think that is more of a term that would be used for a convicted person in a parole or setting. That's not a term that we use there, but I can tell you that every administrative judge has had multiple meetings, probably on a daily or weekly basis, with their state's attorneys and their public defenders. It requires an active management that never occurred before. And they are going over the jail lists in hoping again and encouraging the state's attorneys and the public defenders to work things out. And if they can, we'll certainly take them. And if not, we'll have hearings upon proper motion. And those have been occurring regularly throughout the entire pandemic.
Thank you, Mr. Chairman. Thank you, Chief Judge.
All right, thank you. I see that Senator Castley, if you're still there, I know you had a question. So you are up next. Sandy will unmute you. 1 second here. There you go.
Thanks. So I was blacked out. I had some kids crawling around here. So my concern is whether these releases we're talking about, and look, I appreciate all the work you're doing, the courts, the corrections, to try to minimize the impacts of COVID and keep people who ought to be released from becoming unnecessarily sick. So thank you for that. But obviously the corollary to that is, are we possibly releasing people, and how is that impacting violent crime? I tried to do some quick research on violent crime stats. Maybe you could suggest a good website, because when I Google violent crime in Maryland or crime statistics in Maryland, I get GOCAP, which wasn't updated since 2014, I think it was, and not any other good sources. So maybe somebody could suggest that. But my concern is that as we keep reading how the folks arrested for violent crime have multiple arrests and interactions with the justice system, both either as adult or juvenile, before they commit their first of many murders. And so I am concerned that perhaps this COVID releases might be fueling a surge in violent crime. Maybe someone can respond to A, what are we doing to minimize that possibility? And then B, has there been a surge in violent crime during the COVID?
Senator, I would have to defer to law enforcement under the UCRs for the violent crime information. We do monitor those individuals that are under our supervision that we do release on any of our programs and try to assure their appropriate community behavior.
So are there criteria that you're using? What kind of sense of confidence can we have that the people that you're releasing are not folks who are likely to perpetrate violent crimes?
Well, in the two executive orders that we implemented, Senator, there are specific review criteria. We communicate with the state's attorney's office. We communicate opportunity for the victim, if there's a victim in that crime, to communicate with us. And then there's a comprehensive review by the Commissioner of Corrections prior to those releases occurring. We're looking at individuals primarily that are within 120 days of their statutory release from our custody to begin with.
Okay, and then maybe if anyone has any statistics or information on whether there has been an increase in violent crime during the past year or not an increase.
Mr. Chairman, this is Chief Morris, and I can respond to the Senator's question in some general terms. I can speak specifically to the homicide rate. The homicide rate in the state this year versus last year was up 583 homicides statewide. When we look at the major jurisdictions, Baltimore City was down slightly with 335. Prince George's County had 98 homicides. Montgomery County had 17. Baltimore County had 35, and then the remaining counties throughout the state had a total of 98, which was up almost double over what it was the previous year. I think that generally speaking, we're seeing declines in some of the crimes, such as thefts and things of that nature, simply because we don't have folks out as prominently because of the COVID throughout the year. But some of the more violent crimes are more concerning, such as the homicides and carjackings, particularly here in Prince George's County, which I can speak to with a degree of confidence.
Has anybody got any information or suggestions on what we can do in this COVID world to sort of address any problems that we might have in relating these two? I mean, as we incarcerate less around the state and violent crime goes up, is there a solution, or is it just something we have to accept as an aspect of COVID?
I'll say from a personal and professional perspective that I don't think that any level of violence, regardless of the cause, should be acceptable. And that I feel confident that from the law enforcement perspective, as well as from our judiciary's perspective and our state's attorneys, we're working diligently to identify those individuals that are most inclined to engage in this type of violent activity, and vigorously seeking through the state's attorneys and through the judiciary effective prosecution of those cases. So I don't think the idea that it's acceptable is in anyone's vocabulary. It's just increasingly more challenging. And we are seeing, and I think that it would be fair to say that a lot of these issues are being driven by issues other than just crime, to include the socioeconomic issues, the education issues, and things that are more societally based.
I'm just hoping that COVID didn't suddenly drive down everybody's mental capabilities, so they decided to pursue a life of crime, but maybe that's the case. Thank you.
Understandable, Senator. Thank you. We appreciate all the work that you do as well.
Brian, did you want to say something before we move on to the next? Yeah, we can get on. Go for it.
Okay, thank you very much. I did want to touch on Senator Cassidy's concern. I will tell you that state's attorneys are first and foremost public safety. And just to make sure it's clear, it wasn't sort of any of the work that we did. It's not about just opening the door. I think even it was mentioned previously that many of the people that are in being incarcerated now certainly fit that category. And that is why we have people that may have had their trials delayed, or maybe have been there longer than we expected, but they are in fact a danger to the public, and we continue that. Where I think you saw the proactive nature of prosecutors identifying some of those cases where there was a proper place, not be the threat to public safety. As far as the increase, and I will even use Carroll County as an example, we saw, rather unusual, we saw a bump in number of homicides that we have here. And we saw many, very directly related to domestic issues. So I think the point is what we've seen with some of the violent crimes, I can only speak depending what we see, is the mental health aspects that we're seeing coming into court, domestic violence. We have people that have lost jobs, that are incredibly frustrated at whether or not the schools are not open, the political atmosphere, whatever. It has created a situation where some of the interventions are not as easily accessible. So I think we have seen a real drop. We saw a drop in overdose deaths and overdoses, while at the same time, and I think as Chief Morris said, a drop in some of the property crimes. So it has really been a unique situation. I think in terms of what we see as far as the impacts of this will probably not be for a year or two. Long standing. So hopefully that answers your question.
Okay, thank you very much. I know that I'm going to turn right now. We have the next question is from Senator Carter, but I actually have to go and depart and head to another meeting. So Senator Carter is going to take over. She's got a question. She'll close us out. But before I leave, I did want to say that Senator Casserly, I know your father passed away, and wanted to express our condolences. World War II veteran, and from what I read, just a phenomenal human being. So I just want to express our condolences and say that we're thinking about you. So I'll see you all soon. And Senator Carter, I'll leave this in your capable hands.
Thank you, Chairman Smith. Thank you, everybody, for enduring. I promise that we won't be too much longer. My question is, first, I want to also, Secretary Green, I think my first question is for you, but I want to acknowledge Rachel Sessa and really commend her on being, an ideal person and, agent for you. Every time I've ever reached out to her with any question, I get an expedient, thorough answer. I just, she's invaluable in my opinion. So thank you, Rachel. My question, Secretary Green, way back when you initially gave your presentation, you cited a fairly high number of staff that had tested positive for COVID. And over the course of the pandemic, I've heard from a number of inmates and inmates' families about the extreme amount, I would characterize as the extreme amount of lockdown. Many have said they're not let out of their cell for more than 30 minutes or 60 minutes a day. And I'm believing that the shortage of staff because of the COVID has probably impacted that. And so I'm wondering what, if any, steps you've been taking to ensure the quality of life for these inmates during the pandemic and that they are able to resume regular activities as much as possible.
I thank you for that question, Senator. It's excellent. I think everyone inside our environment has suffered a loss through COVID. Programming, movement is key when we are looking at how do we slow the spread of a pandemic through our system. And we what we started in March, and we're very early on really trying to address that movement, allowed us to endure 2 surges. And at such point, this kind of surge we're seeing now across the country, which many in my chair are experiencing. We stop movement. That is absolutely factual. We've tried to put in other services for our population. The video visitation, which is something that we did very early on, and I will tell you is something that will stay with our department for the future, to be able to keep some successful level of communication and appearance, being able to see your loved ones. We've done that. The free phone calls across our system, again, which we will continue now, I believe, until June of next year to allow for that communication. Our colleagues at Labor, where twice we have, very similar to the courts, we've phased, we've started, then we've had to take a step back around our educational services. We were rolling back into our educational services only to see a surge, then have to take a pause. So our colleagues at the Department of Labor, how they've been able to keep some semblance of educational services in our system. MCE, as you know, Senator, is a huge workforce development program within our system. But I will not sacrifice the safety of the inmate population for a production number. And that has been impacted, and that has been impacted in our ability to really do that reentry program. I'm saying that to say this, Senator, everything has been impacted when we look at the safety of the inmate population and the staff, the number of quarantines that we have had. That's why I think it's been so important for us to be in lockstep with CDC, with Maryland Department of Health, Dr. Mitchell, who is here, who has just kind of monitored that community spread with us and advised us along this journey. That's why right now I'm so pleased to have the vaccination, and with great passion told you that tomorrow at 7:30 we are going to really move expeditiously to utilize that which we have, because while it will have a direct and dynamic impact on our congregate care environment, but everything we have done, we have tried to keep in mind that we are not only a correctional system, but we're a system where people live, and to balance that for both our staff and that population has been a Herculean effort.
Thank you.
Carter, if I may, first and foremost, your kind words are just, I so appreciate that. And I hope you know that I truly appreciate working with you, and absolutely any day, time, or night, if you ever have any issue or any inquiry or concern, please don't hesitate to reach out. Just to kind of piggyback off of what Secretary Green was indicating, and that is we've also done like dietary enhancements, meal enhancements, just trying to really, show, food is love. So through food, trying to really appeal to the incarcerated population and say, hey, we know that this is extremely difficult. Communicating, ensuring that our leadership is communicating with the population. We do daily COVID-19 calls where facility leadership report out the temperature of the facilities and kind of how the population is managing, and rolling out telepsychiatry and telemedicine so that there's increased access through the virtual platforms as well.
Thank you. Secretary Green, can you give us an indication of where you are in the process or the percentage of inmates that you've been able to have expedited parole hearings that fall within the 120 days of their release or their expected parole? Have you been
under the
far with that?
Thank you for that question, Senator. It was a little broke up. I didn't mean to interrupt you. My apologies. The parole release process and the expedited release in the 120 are two different parts of that executive order. We're in the middle of that last executive order now. And if you would allow, we would be able to give you that figure, be able to give you those figures in the next week or so. Is that okay?
Absolutely. And I realize the hour is late. And so my last question, thank you very much, is for you. Judge Morrissey, thank you for hanging in there. And you brought this question on yourself to some extent. You spoke about the limitations that the judiciary has in the home detention in some instances, and you probably know that we are considering legislation this session that would increase access to home detention for persons that can't afford the private use of home detention and the expenses with that. And so my question is, if you have any suggestions on what we might do, to ensure that those limitations that you have in ordering the home detention in some cases, to eliminate those with our legislation. I mean, we certainly want to work with you, but we'd like to get, your input as well.
You're trying to get me in trouble, Senator Carter. Certainly, we'd be more than happy to work with you on that. I saw Baltimore County recently just eliminated the fees for home detention. I think those are all great steps in the right direction. I think some of it is fiscal and some of it is operational, but I'd be happy to work with you, Senator.
Thanks so much. And thanks to everyone that presented today. We really appreciate your work in these difficult times. We look forward to working with you in the legislative session. I'll briefly give a shout out to Major Reese. You presented some really troubling issues with respect to mental health and the lack of testing. And I want to say that we certainly want to work with you to see what we can do to provide additional supports and resources, because those are critical things. But aside from that, on behalf of Chairman Smith and the whole committee, thank you so much. We look forward to working with you. Stay safe.